In this video, we are going to look at psychological and neuropsychological assessments. Some signs that a student might need an assessment include they are having a harder time with life than you would expect, they become frustrated by their struggles at school, they have a hard time maintaining relationships with family and friends, you or the parents often end up making excuses for their behaviors, or they are not as happy as it seems they should be and there is no apparent reason why. These types of assessments are the best way to get a comprehensive diagnosis of a child's developmental, emotional, intellectual, and academic strengths and weaknesses. Assessments of this type involve many pieces. An assessment should include specific tests, interviews, a review of student records, discussions with other professionals, and observations of the student. The data collected from all of these pieces should give some good answers to questions about a child's functioning, skills, behaviors, and emotions. A psychological assessment looks at what factors might be causing a child to have trouble functioning in their daily lives. This includes their behaviors in learning at home, in school, and other places in the community. This is to hopefully help take away misdirected labels or assumptions about students like they are lazy, hyper, or that they're just mean. So what are some questions an assessment should answer? Well, there are many, like, is a student gifted or in need of enrichment? How do they learn and process information the best? Do they have a learning disability? What are their strengths and weaknesses both academically and socially? What are the specific characteristics of those strengths and weaknesses? What will be the best individualized plan for them? Do they have a disorder or disability? Does it deal with attention? Is it psychological? And what recommendations can be made from all of this information? These assessments must be done by a clinical psychologist or neuropsychologist. This is because they are especially trained to administer the different tests, interpret them, integrate the data with their history to give a strong diagnosis, and look for patterns of strengths and weaknesses in different childhood disorders. Pediatric neuropsychology looks at the relationships between the brain and behaviors a child expresses during their development. A pediatric neuropsychologist is trained in how behaviors and learning are related to the brain development. When giving a pediatric neuropsychological assessment, it should include things like language, social skills, academic skills, interviews with parents, visual and motor abilities, reviews of academic and medical records, and a child's development from birth.